So the first speaker I would like to invite up is from UNSW on the role of family carers in navigating home-based aged care services. Over to you, Yuchen.
Hi, can everyone hear me okay? Okay, perfect. Thank you. So thank you very much for Professor Kirby and for the and also thank you, Karen, New South Wales, for the wonderful opportunity to share my research today. So today I'm going to share one of the study from my PhD research and looking at how older Australian and the carers navigate aged care systems, specifically home-based aged care system in Australia. And the role of family members in helping with navigating. So I'm going to begin by talking a little bit about the broader aged care navigation journey in Australia. So we know there are aging population in Australia, and actually most older Australians prefer to receive aged care services at home. And in fact, the home care use has increased by 283% from 2017 to 2024. And here is a flow chart that shows a typical stage of the journey to navigating formal aged care services, the home care services in Australia. So in Australia, we have two types of home care services. The first type is called home care packages, HCP. So that's more suitable for people having complex care needs. And we also have CHSP, which is Common Health Support Home Program. And so as you can see here, we have different stages. So from learning about different care options to contact my aged care services and get assessment, finding care, and select care provider and manage your care plan. So in reality, this journey is either undertaken by older Australian as care recipients themselves or by family carers who assisting them in any of the stages. With that, I also wanted to give some background on the existing literature insights on this program. So to help inform this study, we also conducted a scoping review looking at how aged care navigation is conceptualized in the international literature and what we know about the carer experience. So as you can see here, we find that family carer play a crucial role in helping older adults access and navigating health and social care services. And carer often act as a lay navigator without formal training, and they facing various types of challenges due to limited system knowledge, time constraint, and unclear service pathway. And there is also important concept called structural burden, which refers to the time, stress, and emotional burden placed on carer due to navigating the fragmented system. However, most of the literature are from North America, meaning USA or Canada. So very few research in Australia about the navigating aged care system from consumer perspective. So consumer refers to the older adults or family member themselves. Informed by that, so here come to the end of my research. So we want to better understand the experiences and challenges of older adults and family carer who provide non-professional assistance with home-based aged care navigation. The two key research questions are what are the barriers for them to access home-based aged care, and what are the unique experience of those from culturally and linguistic diverse community within the Australian context in their navigation journey. To answer those research questions, we use a mixed methods approach using semi-structured interview and a short survey to examine this question. To be eligible for our study, there are two types of participants. So older adults either receiving or waiting to receive home care package or the Commonwealth Home Support Program, or a family member, a family carer who assisted older adults in receiving or waiting to receive the home care. As we also wanted to include people from the core community, so the participants need to be able to communicate in English or Mandarin due to my own language capacity, because I conduct the interview by myself. We use convenience sampling and put the advertisement flyers through different channels, social media, and some research volunteer registry, newspaper, and also get help from one of the multicultural community organizations to recruit people from core background. Here you can see a profile of our Carol participants. I forget to mention, so for the forum, I will only focus on the finding for people as Carol participants, not the older adults participants. So we get 11 Carols in total, and 4 of them are identified from core background. Most of them are female, so 9 female, and age ranged from 33 to 72. Most of them, all of them actually are using internet in the last 3 months. In terms of what who they provide navigation support to, most of them are adult child carer provide navigation support to their parents, and 3 of them are spousal or partner carers. 1 is a grandchild provide navigation support to grandparent. Among those, actually among all the carers, so 11 carers reported using internet. And here we also gave a multiple choice question to ask what are the reasons they access internet in the last 3 months. So here you can see the breakdown. Most of them using the internet for paying bill or online banking, and a lot of them using it for entertainment or social networking. What I wanted to highlight here is most of the carer actually do use internet to find relevant information and support resources for aged care support, but less than half of them actually using internet to find assistance to care about themselves or find the carer related information. So I'm going to move to some of the qualitative finding from the carers. So I'm going to first go through the themes shared by core carers and non-core carers. So the first thing is about the complicated nature of navigating the aged care system. For example, a daughter of a home care package recipient said that my sister and I found it's really difficult to navigate the aged care system, and mom would have no idea how to go about it. And we can see a similar quotes from another partner carer said it would be very difficult for somebody who was outside of the system or old and in poor condition to navigate the system. And it also mentioned the computer literacy. The second important things we found is being the only navigator in the family. So the first quote is from a core adult child carer, and he said, "I'm helping my father apply for this alone, and I'm the only child." Another quote is from a non-core carer, a partner carer. He said, "My son and daughter both are several thousands kilometers away." Although they probably being the sole navigator in the family for different reasons, but I think this example highlight being the sole navigator can result from different family dynamics and also depends on the cultural background. And another thing is the lack of awareness of carer support, and this really is consistent finding of our survey results. If you remember the breakdown of the reason of using internet. So one partner of the partner carer said, "I have been told my sister that I may be eligible to apply for carer's allowance, but I'm not sure about the process and I haven't investigated that yet." And we can see some similar experience from core carers as well. So some of them are not aware of they are eligible for carer payment, and And some of the carer attend aged care knowledge workshop held by care provider for their parents, but didn't find such a support for themselves. I mean, I should say not aware of such support. So there are some unique things for those from core community. So the first one is family-based navigation support. If you can read the quotes here, so one of the daughter of care recipients said, I fill out some of the application form for my father. And another shares similar experience. My father shouldn't be able to read this bill because it's all in English. So for those from core community, they usually rely on their adult child carer on the health literacy and language proficiency. And some of them using social media as a key information source in addition to the assistance received from their family member in terms of navigation. So one partner carer shared that I pay attention to those in a social media group. So which is basically is a social media group similar to WhatsApp, or maybe a mix of WhatsApp and Facebook. So among Chinese community. So otherwise, I really didn't know there was a service before. So they're trying to use social media as an opportunity to stay engaged with the information and resources. Come to the discussion slides. So what we've learned from those findings. So first of all, we know that carer play a central but often under-recognized role in navigating aged care services on behalf of their older relatives. And carer often lack of awareness of support services from themselves across both our survey and interview finding. Even when they are actively seeking information for the older persons. For those from the culturally and linguistically diverse background, those carers face additional language and system barrier, but they are using social media platform that are accessible by their own community language to stay informed. For future direction and discussion, I think future research should aim to better understand the invisible structural burden of aged care navigation work among family carers and explore the navigation challenge faced by carers from other core communities. The reason is because my language capacity, most of my carers from core background are actually from East Asia, meaning Chinese speaking. So I did have probably one carer from India background to attend our interview in English, but consider the multicultural context in this country, and also 1/3 of the home care user in Australia actually speak a language other than English at home. So I think we should include a broader community from core carers for future research, and we should in long term develop some culturally appropriate strategy to support them as well. And finally, more importantly, I think we should increase carer awareness of existing navigation support. So I know Carer New South Wales did important work in this field. So when I first started my PhD as an international student, I actually signed up for the Carer New South Wales webinar on navigating my aged care to understand the complicated aged care system in the country. And it's really helpful and worth the time to understand it because it gave a very broad, concise picture and detail about how to navigate and introduction of the aged care system as well. However, from my study, most of my carers are not actually aware of those good support services. So I think even there are few aware of those webinars do exist, but they probably don't have the time if they are working at full time. So I think for future thoughts, maybe we should consider some strategy to make a more reachable and accessible format for those time poor carers and to reach more people as well. And maybe we can also use for those from core community, we can design or advertise those great resources into the community language and in the social media platform that are used by those carers. This by acknowledgement slides and the reference list if you are interested in any of the literature in my presentation. And thank you very much, and happy to take any questions.
Thanks so much, Yuchen. Any questions? I might run around the room with a microphone so that we capture it all for the recording.
Or any comments as well, yeah.
I was just thinking back to this, the survey of disability aging carers has a range of questions around internet usage and those sorts of things. I was wondering if you had any reflections on how your research field has changed across the last sort of 5 or 10 years as the internet means different things now, perhaps in the generative AI sort of use of IT sense than what it did 10 years ago, or even 20 years ago, where people were dealing with dial-up modems and access issues and those sorts of things. Maybe a shorter way of asking that question is, what gets you really excited in this field around your research area about what we should study?
Yeah. Thank you very much for the question, Professor. So I think in terms of one of the important things probably I didn't have enough time to talk about is a lot of people, like older adults as care recipients or carer themselves, report that digital literacy and access to internet all the time could be a barriers to access the aged care or interact with the aged care system, especially for our older adults as a participants. So most of the carers, especially those adult child carers, are very proficient and tech-savvy carers, so they actually provide a lot of time to help their older relative to navigate the aged care system. And I think, but some of them, if they are not live together with the other adults, so the location and the time could be a barrier for them to provide such navigation support. It's good you mentioned about the generative AI or the chatbot support, and from my interview, we haven't included question about that. Maybe in the future is a good, I think it's a good direction to explore for future researcher, and I believe there's some potential. Maybe we can get some support from those AI tools as well. Yeah.
Thank you. Any other questions, Nick?
In regards to the language barriers, did any of your participants talk about the translation services within My Aged Care? Did any of them try to access that? Like, was that something that they even knew about? Because I know you can change the language online, and whether that was any good.
Yeah, so do you refer to, can you clarify, do you refer to the transition, like the service from hospital to home, or?
Just on the My Aged Care website.
Yeah.
Like, it's like, you know, the government has the ability to translate their website.
Oh, the translate. Oh, yeah. Sorry. So yeah, that's a good question. So I did explore by myself as well, and some of my participants said, so in the current My Aged Care website, or maybe last year when I did an interview, so people from the core community, they say there's some button you can click to translate, but it's actually using the built-in browser translate like Google. There are several browsers, maybe, you know, like Introduction of Home Care Package or the Commonwealth Home Support Program. They probably translate the voucher, you know, the short version of the voucher in maybe Chinese or other like language, community language, but that's not the entire story. So if you wanted to have, you know, the entire website, each click or each single button, if you click, it's actually built on, rely on the Google translation or the browser you use.
Okay, so there can be mistakes in that.
Like, yeah, so I try some of them. It's probably understandable, but it's not exactly appropriate, like in a cultural context, and or sometimes could be has some mistake. Yeah. So most of the time they actually when they call My Aged Care or fill out the form, they have to rely on their, adult child carers. Those are like migrant children probably have better health literacy and English literacy to help them make the phone call. And they did struggle because some of the carers are full-time workers, then they have to find time to call My Aged Care. But when they are available, then it's after office hour, things like that. So it's very hard to balance, the
Thank
work
you.
and carer.
Thank you. Any other questions? Yes, this is great.
Thank you. It's a great presentation. I just wondered about that concept of structural burden, about navigating fragmented systems and how it relates to administrative burden, which is something I've probably seen more about in the disability space.
Thank you. That's a great question. So from my understanding, so the structural burden generally refers to the time and stress you as a carer devote to interact with a complex care system. It could be social or healthcare system, including aged care system as well in this background. It definitely should include the admin burden, as you said, because you have to make phone calls or fill out the forms or trying to search online to make sense of understanding the care options or the care provider, compare them or compare the cost. Those are all admin burden. So I believe within the aged care context, most of the structural burden include the admin burden, as you mentioned, yeah.
Thank you. Some wonderful questions there to kick things off. Sarah?
We've got an online question from one of our online live streamers, from Marie, who's a carer and a researcher. She wanted to ask whether the carers, sorry, one moment, observations or carer reporting challenges in accessing carer support payments within the context of having to have the care recipient's GP's knowledge and understanding of how best to respond to questions in order to accurately reflect the carer support provided. Let me just read that again. So I guess, have any of the carers reported challenges accessing carer support payments around the GP's involvement, I guess, and how can we best respond to questions to capture the carer support provided?
Thank you. Great question again. So from my memory, when I interviewed some of the participants, I think a lot of carers actually not fully aware they are eligible for carer allowance or carer payment. So I'm not sure about the GP interaction in my case. I do have some older adults participants as care recipient. They do get about aged care information, how to navigate from their GP interaction, but it varies by the participants. I think in my participants, as a carer participants, a lot of them are not aware of those services. So actually after my interview, I do share with them the resource I know, like Carer New South Wales or Carer Gateway, and tell them there are webinar and seminar available that they can access. So yeah, I think it would be good to do some follow-up study or a future research to understand what is the reach and accessibility in terms of awareness and actual usage of those support services. Yeah.
Thanks, Yuchen. Certainly an incredibly interesting example, I guess, of that lay navigation, the difficulty that people have and the kind of hidden curriculum and sort of informal pathways that people have to go through, whether it's social media, other forms of family or community kind of communication in order to access care.
Yeah.
Please join me, everyone, in thanking Yuchen again.
Thank you.